Hi, good morning, everyone. Thank you for making time today for today's training on the subject COVID-19 prevention is better than a cure, which will be undertaken by Colonel Dr. Noor Ashikin. So before we begin, I would like to just point out some ground rules for today. So if you have any questions, please use the Q&A function that's available in Zoom so that we can actually tabulate and monitor your questions so that we can actually raise them to Dr. Noor Ashikin at the end of the session. So today's format will start off with the session, of course. There'll be a short break in between for about maybe 10-15 minutes. And then after that, we'll have the second part of the session. And then we'll then end with the Q&A and also some announcements about upcoming training over the next few weeks. So without much further ado, I'd like to pass the time to Dr. Noor Ashikin to begin the session. Okay, Dr. Noor Ashikin, over to you.
Hi. Right. Okay. Okay, thank you, Mr. Chris. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and salam sejahtera to all. Thank you, Mr. Chris, for the invitation. I'm very fortunate to be given the opportunity to be involved in this training session. I'm glad to know actually there are about 78 participants who are participating in the training session. Okay, basically I'm used to give talks and training to the military doctors as well as healthcare professional and also medical staff, as this is my first encounter with a non-medical audience. I'll try my level best to deliver using non-medical jargons and simpler terms, and I hope I don't confuse you all. The topic of my presentation today will be prevention is better than cure. I think every one of you should have heard about this topic. This proverbs is actually an old proverbs that signifies the importance of oneself from getting any sort of illness or disease by practicing certain precautionary measures in order for us for us to not getting any contracted any disease or infection. Okay, so much so to the prevention can be done for any kind of illness that exists in the world. For example, I would like to start with diabetes. I think all of us may know about diabetes. Okay, is in Malay we call kencing manis, right? This disease actually has affected almost half of the adult population in Malaysia. For your information, our country is the champion in Southeast Asia to be amongst the highest prevalence of diabetes in the Southeast Asia. Okay, and for diabetes, it is actually can simply be prevented by consuming less sugary food and also less carbohydrate food, and maybe more exercise to burn all the excess sugar in your body. That is also part of prevention. And for heart disease, it also can be prevented by basically going active, do a lot of physical activities, and also stop smoking. That is also part of prevention of heart disease. And as for lung cancer, we heard a lot of cancer and also all other cancers like bladder cancer, prostate cancer, bone cancer, breast cancer. It also can be prevented, and in lung cancer especially, simply by just stop smoking or avoid cigarette smokes. Okay, how about COVID-19? So can it be prevented? Okay, definitely the answer is yes. Okay, in my presentation today, I'm going to introduce again about COVID-19, a little bit on the history, how she is presented in human body and what are the symptoms. Maybe you can show the slides. the available okay, next slide. Okay, and the okay, how she's presented in her body, what are the symptoms, the available, the content of my, I think go back to the previous slide, the content of my topic today, the available treatment, and I'm gonna touch also on what are the complications of COVID-19. Last but not least, I'm gonna cover on how we can prevent the virus from coming into our body. Okay, next slide. Okay, there she is again. A very nice looking virus called COVID-19. She was born, date of birth on the 31st of December 2019. And the place of birth is in Wuhan, China. Mother is we call coronavirus. And the surrogate mother is actually bats, or in some mammal. In this particular case, is pangolin. She is now 7 months, as of last week. She is now 7 months, 24 days old. Okay, and was born in Wuhan, China. The mother virus we call coronavirus, and COVID-19 is actually a mutated novel virus from a mother virus and become a new breed of virus we call COVID-19, a short form of coronavirus disease 2019. Okay, as I told before, she is a bit dangerous or nasty compared to the other siblings, the influenza, the SARS, MERS-CoV, which all causes respiratory tract or lung infection. Okay, maybe you can share you how COVID-19 differ from the seasonal flu. Maybe next slide, please. Okay, this is the pictures of, on the left-hand side is the COVID-19, while on the right-hand side is flu virus, the usual flu virus. Some people might mistaken that the influenza virus is just like COVID-19. Okay, but it's actually no. COVID-19 is much more dangerous as compared to the influenza. It is said that COVID-19 can kill up to 45 times more as compared to the seasonal flu. Okay, a little bit on the evolution of the coronavirus. Next slide, please. Okay, I just share this picture, evolution of coronavirus. I think all of you know about SARS in 2003. As we know, back in 2003, there was SARS virus, which has killed not as much as COVID-19, almost 774 people in the whole wide world, and it affects almost 1,000 people. This SARS-CoV is a new virus that emerged through recombination, meaning is combined the SARS-related coronavirus and the recombined virus, which then infect the civet and then human, and it adapted to this host before causing the SARS epidemic. I just put the Batman there because bat is a Batman here. Again, bat is one who cause who are the natural host of this virus. Okay, then 10 years later, about 2012, 2013, there was MERS-CoV. It has killed 876 people and affected almost 2,500 people all over the world. The Middle East respiratory syndrome coronavirus likely to spill over from bat, the Batman, to the camel at least 30 years ago, and since then has been prevalent in the camel. Okay, only in 2013 it has caused symptoms and affect humans. based on the recently released data on COVID-19, it is actually closely related to these two viruses, the SARS and also MERS-CoV. Okay, and that were isolated in bats, and it suggests that the bat COVID and the COVID-19 share the common parent, the common ancestor. Right? Therefore, the novel coronavirus 2019 is considered to be a SARS virus, and it was also named as SARS-CoV-2. Okay, in 2003 it's SARS-CoV-1, and 2019 is SARS-CoV-2. Okay, up until today it has caused more than 500,000 deaths worldwide, and also has affected more than 14 million all over the world. The new coronavirus, COVID-19, is first isolated from a stallholder who worked at the South China seafood market in Wuhan. This market is believed also selling animals or mammals, which were likely to be the intermediate host of COVID-19. And this is originated from a bat host. Okay. It has been speculated that the intermediate hosts, which are the wild mammal, has been sold to the seafood market in Wuhan. Right? Unfortunately, since our last meeting last week, the case in Malaysia has risen from a single digit to a double digit. I think go back, Chris. And it is believed to be due to the imported cases. Okay, COVID-19 is mainly transmitted through droplets from the respiratory tract. As we know, when you cough or you're infected with COVID-19, when you cough or sneeze, your secretion contain the virus, and it can go to the next person next to you. Okay, if he stand less than 1 meter, he will get the virus. It is said to be stable for few hours on a surface, metal surface at cold temperature. And there are few COVID-19 transmission that occur through fecal material, but the risk is low, and it also can be transmitted through breast milk, as I mentioned before. Right? As you can see from the slides that presented now, is animal origin of human coronavirus. The natural host, as you can see, this is all the human coronavirus. The natural hosts are mainly bats, and 2 of them are rodents. The one that causes severe illness is the one with red lines. As we can see here, from bats transmit to the civet, causing SARS-CoV, and bats transmit, spill over to the camel, causing MERS-CoV, and bats maybe spill over to pangolins, causing the COVID-19. All right, there's few other coronavirus that has been detected, but he actually has caused only mild infection, as you can see based on the yellow lines. Okay. All right, maybe we go to the next slide. Okay, next. All right. Okay, these are the symptoms of coronavirus. I think everyone know. The symptoms are mainly cough, sore throat, fever, muscle pain, chills, yeah? And in severe case, shortness of breath or difficulty breathing, and peculiar symptom, which is loss of taste or smell. But this happen only in 20% of the cases. Majority of the cases are asymptomatic. About 80% are asymptomatic. Right? Another 20%, which I mentioned just now, can be very severe disease, and it occur especially in elderly and also those with chronic diseases such as diabetes and hypertension, kidney problem, chronic lung problem, and also heart problem. And as mentioned last week, the COVID-19 also takes slightly longer time to recover compared to the seasonal flu and also the other viruses. It may range from 2 weeks up to 6 weeks, depend on the severity during the first onset of the virus. If say you have COVID-19 but you don't have symptoms, you never know when are you going to recover. But basically, it takes almost 2 weeks. That is the reason why we need to quarantine ourselves. If you come back from overseas or affected countries to Malaysia, you need to quarantine yourself, even though you don't have any symptoms, for at least 2 weeks, right? If you have symptoms and COVID-19 is positive, in Malaysia, we isolate them in the hospital. The designated hospital in KL is Hospital Sungai Buloh. In Ipoh, it's Hospital Ipoh, and several other hospitals all over the country. Right? So if you need to be quarantined, you need to be quarantined. Please don't go out. Stay at home. Okay. I think I'll be going a bit too fast. I'm going to the treatment part. Maybe we go to the treatment. Next slide. Okay, I hope you can see the slide is actually a projected timeline for treatment and also prevention. Okay. COVID-19 is a new virus, it's a novel virus. So scientists are basically struggling and going very fast, breaking speed record in their race to develop treatment for the new coronavirus. The progress to develop coronavirus treatment and prevention is moving very, very fast as compared to the other treatment. With historic record actually being broken almost every week. So if you are gonna be one of the champion or record breaking, you're gonna need to be involved with COVID-19. Okay, as you can see here, this is actually a visual timeline to help you understand on how and when scientific innovation may help us through this deeply challenging time. Maybe for a start, we go with the leftmost, the green area. We show repurposed drugs. Okay, what are the repurposed drugs? Repurposed drug is actually used as the fastest way to safely stop COVID-19. It is actually the treatment that already being discovered and already being approved medication to treat certain other viruses or certain other illnesses. And we use these drugs to basically to try and treat COVID-19. Usually before you produce a new drugs, a new medication, you need to go through a serial phase of trial. They're gonna have phase 1, phase 2, and phase 3 trial. And some of these drugs takes longer time to be, okay, some of these drugs takes longer time to be approved and used to treat certain illnesses. Okay, so since the virus are very fast moving, so the scientists or the doctors use the repurposed drugs, meaning the drugs that had been used to treat certain viruses, such as in this case, Ebola, HIV, malaria, and also hepatitis virus. So by using these repurposed drugs, it does not require the same extensive testing as novel medicine and may already be available at large quantity. And so far, there are actually 7 drugs that has been put in this category. Okay, and as I've mentioned previously, they are all drugs used approved to treat a known disease such as malaria, okay, hydroxychloroquine, HIV, oseltamivir, Ebola, hepatitis, and also hepatitis infection such as interferon, subcutaneous interferon. Okay, these are all the drugs that has been used to treat other diseases, but is tried in patient to treat a patient with COVID-19. Okay, then we move to the middle part, which is the antibodies. Okay. The second approach used to treat this virus is by using antibodies. Antibodies are actually a protein that are natural part of the human immune system. They work around the clock in blood to block the viruses and more. The problem at the moment is because the virus, the COVID-19 is new, no one has developed antibodies against it. No one except for those who had recovered from COVID-19. And this antibody are then taken from those people that has already recovered from COVID-19 and were given to the patient who are still infected. Such patient-to-patient transfer can be performed without laborious testing or without lengthy approval, so long as the protocol is followed. Okay, it is yet known whether this treatment will work for COVID-19 or not, nor whether there will be enough recovered donor to deal with the infection, which has now occurred at very, very large scale all over the world. Okay, there are actually special techniques to screen through millions of beta cells. Beta cells is actually cell in our body that produce antibody. Okay, this beta cell are responsible to produce antibodies, and this beta cell that are producing the antibody, then we take the antibody and it is used to neutralize the virus. Normally, this would be a 5-year program, but some company funded can do animal study, and it occur as fast as 2 months. Okay. There are also several methods to develop this antibody, such as combining the antibodies, developing the antibodies, which involve genetic engineering technique, where the mice mimic the human immune system, and then we give the virus to the mice develop the antibody from their beta cell, and we take the antibody from the mice and give it to the patient who are severely infected with COVID-19. All right. So this is all about biotechnologies in the lab. They also involve computational approaches, and also they're using a lot of AI, artificial intelligence, to develop these antibodies. And the third way is actually they are using computers to re-engineer this antibody to target the COVID-19. Okay, the last is actually vaccine, as you can see from the blue lines. Okay, the vaccine now actually just entering phase 1, by next year, it will go into phase 2. Maybe by end of next year, it will go into phase 3, which means then only the vaccine can be used for people, for human, to be vaccinated and prevented from getting COVID-19. Okay. How does vaccine works? Do anybody know how the vaccine works? Okay, vaccine works by actually simulating infection. The vaccine are given at low dose to the virus actually are given, or weakened virus actually are given at a low dose to a human, then which allow the body to develop its own defense against the virus. The effective vaccine takes time to develop, and they can even take longer time to test. To date, roughly average time for a vaccine to develop would take about 1 to 2 years time. So be patient, everyone. The vaccine will be ready, inshallah, by end of next year. Hope and pray for that. But recent progress in biotechnology can help actually to accelerate this effort. And okay, as for COVID-19, there's one company actually has got approval for vaccine testing in just 44 days, in which in normal situation it will take longer time. Okay, this is all the speed and the record the scientist has breakthrough to develop the vaccine against COVID-19. All right, I think maybe before I go to the complication and also the prevention part, maybe we can have a break, Chris, or any question?
Yeah, okay, sure. Okay, everyone, we will take maybe a 5 to 10 minute break here so you can go to the washroom and whatnot. Then we will come and resume. We'll come back and resume at around 10:40 a.m. So okay, so thank you, everyone. Yep. Hi, thank you everyone. So we are welcome back. We're now going to go into our second half of the session. So without further ado, I'd like to pass the time to Dr. Shikin to take over from here. Dr. Shikin, over to you.
Thank you, Chris. Okay, I think we gonna go next. Next chapter of COVID-19. I'm gonna discuss on the complication of COVID-19. Maybe you can up the slide of the COVID-19 complication. And we have the slide, Chris. Okay, as I've mentioned before, the most affected organ in your body in COVID-19 infection is the lungs. That's what known most to us, because COVID-19 is actually a respiratory or airways lung infection. Basically, it's a lung infection, right? But as you can see from slides over here, it can affect all organs in your body, which include from top down, can affect the brain, and then to your lungs. It can also affect your heart, and to the other organs such as your pancreas and also the kidney. Not to forget also the liver, right? Okay, and as for neurological complication, it affects the brain and the nerve, which cause long-term, we call neurocognitive impairment, which affect how your brain function, and it also affect how you think, and it affect your memory as well, right? This neurocognitive impairment ranges from feeling numbness to your hand and feet, and muscle weakness, which can lead to imbalance of your body, where you cannot walk steadily. Your body feel imbalanced, like you were like in a sailing boat, okay? And you can be confused, poor concentration, cannot concentrate well, and also it can affect your memory. This usually occur especially the critically ill patient. Okay, and as for the lungs, right, it can injure the lung tissue, whereby when the infected patient sneeze, you inhale the virus, it goes into your nose, and then it goes into the airways and is into the trachea. When it goes into your lung and lung tissue, basically it causes the lung injury to the tissue. Okay, your lung tissue will get damaged, and later it will become fibrous. Fibrous means, in other words, is actually scarring of the lung tissue. This is can best imagine. You just imagine a new sponge, where it can be expand well, and when you have been using the sponge for too long, and when it dry, it become hard. That is what you can analogically see how your lung respond to the COVID-19, right? When your lung get scarred, or fibrosis in medical terms, you cannot breathe properly. You have shortness of breath, and you might need oxygen in long term, right? This complication, which actually most worrying part, because once you cannot breathe normally, you don't have enough oxygen, and it will also affect the other organs of the body, which won't receive enough oxygen. The other organs, the important organs is our brain, our heart, and our kidney. All right. Okay, and apart from that, apart from the lungs, once the virus enter into the blood system, the blood circulation, it can also goes to the heart, whereby it also injured the heart muscle, and the heart muscle will become weak, and it don't have the elasticity to pump the blood to the whole body. Okay, the weak muscle, the heart, causing the pumping action impaired, yeah, then you don't have enough blood supply to the other organs of the body. Okay, that is what we call cardiovascular complication on the right hand side. And same goes to the other organs. We call pancreatic injury, acute kidney injury, acute liver injury, because once the virus goes into your system, it damages everything, all the organs. In severe case, when you have injury to the kidney, your kidney cannot filter anymore and cannot remove all the toxic substance, and you cannot produce urine. You're gonna need dialysis to do all the job. Okay, and for liver injury, it's even worse. Okay, you cannot remove or cannot metabolize all the toxic substance in your body. Your body will be acidic, a lot of toxic, and it can cause and will lead to death in this case. Okay, same goes to the pancreatic injury. Pancreas is actually the important organ that produce hormones that control our sugar, such as insulin. Okay, if you damage your pancreas, you might also get diabetes. Yeah? Once you are COVID-19 patient and it affect your pancreas get damaged, and later on you develop diabetes from the pancreatic injury. Okay, what is cytokine storm? This is more dangerous. The word storm means it's like a reboot in your bloodstream. Cytokines just means all the chemicals interaction in the body goes haywire. It's just like a thunderstorm. Yeah? It just go out and just circulate all around the body. When this chemical comes into your bloodstream, what it will do, it will affect the blood circulation, and it will also affect the blood vessel. And in this complication, you're gonna see there will be a multiple blood clot. Blood clot means just the blood is clotting all around the body, which can occur in your lungs. It can block your lungs, block the circulation to the lung. It can also block the circulation to the limbs, and which later on when it block the circulation, your body or your legs, your lungs cannot have the blood supply, and the cell just dies off. Okay, septic shock is the worst complication. Shock means in this case all the blood pressure will go down. Basically all the organs all shutting down. All right, in this case usually septic shock occurs once the patient who are critically ill in the hospital for too long. There will be a secondary or a bacterial infection goes into the bloodstream, and when the bacteria goes into the bloodstream, it will make the condition worse. Initially you have COVID, which is the virus. Once the virus has weakened your body system, there will be a bacteria comes in your bloodstream. Bacteria combined with this virus, it will make the condition even worse. Okay, that's the reason why there is a high death rate or mortality rate in COVID-19. Okay, to touch a little bit on the stigma to COVID-19, as I was said before the last week webinar, majority of the patient were treated like a time bomb, and their friends socially outcast them, their family. Yeah? This will lead to mental burden. They go very stressed and later on get depression. This also a main mental health issue that we should focus on after the COVID-19. You imagine you being locked down for 3 months, what happened to you? Some of you may become very happy because you don't have to go to work. All right, like me, I have to go to work every day despite the MCO. Okay, some of you who like to go shopping get depressed because they cannot get to go shopping and buy things that they like. Okay, some of you become well, and some of you become depressed. Some of you eat a lot and become very big, very obese. Okay, that's what happened when you are locked down for too long. Okay, and the other complication that I mentioned is to the children and to men. To children, it can also cause skin problem, rashes, everything, and also weaken the heart. To the men, it can affect the fertility. The fertility is kesuburan, so they might become important if the virus goes to the genital system. Okay, I think that's about the complication. Maybe you can go to the next slide, Chris.
Actually, we have one question from the audience. Someone is asking that if someone who has contracted COVID-19, if the patient exercises, can they recover faster if they exercise? I think that's a question that came from Mr. Wilson Lim. Yeah.
Oh, should I answer now?
Well, if you have time, I think we can. Yeah, you can. Yeah.
Oh, if you have COVID-19 and you want to exercise, that is not a good idea. One thing about when you have infection, okay, be it normal seasonal flu or influenza or just small flu virus, mild cough, you are not allowed or you are not advised to do exercise. So if you have COVID-19 and you do exercise, your condition will become worse. I hope that answered. Okay, yeah. If you have any infection, please don't exercise. You have to rest. That's when your body need rest. You don't stress your body more by doing exercise. All right. Maybe we go to the prevention part.
Yeah. All right. Thank you, Dr. Ashikin.
Okay. Maybe next slide. Okay. I just would like to show this chart. Case positive mengikut negeri in our country. Okay. As of yesterday, 12 p.m. We have yesterday 9 new cases. Before that it was 18. Before that it was 21. So it's a bit alarming because the number of cases has sort of increased. And the total case in our country is 8,840 people, and with 123 deaths. Okay, right now in ICU there are 5 patients. Hopefully they are okay, doing well. So far in Malaysia, the recovery rate is very good and the mortality rate is very low. I hope those in ICU, we pray for them to be safe and recover. Okay, and you can see here okay, next, I think can go next. The trend, yeah, from our last meeting on the 17th July. I was so happy the day before, it was 16 July, there was only 3 infection, and after our last meeting the case suddenly rise to 18. Okay, these were the case that came from those who came back from overseas. right, contracted the viruses from overseas, and they were quarantined then. Okay. And after that, a case seems to be not really, I mean, the number is not really nice to look because it's already double digit. I hope yesterday is 19, maybe today is less than 9. Yesterday is 9. I hope today is less than 9. Okay, let's pray for that. Okay, next. Okay, what we can do as an individual. Prevention is better than cure. You don't want to get COVID-19, right? I don't want to get COVID-19, right? So as an individual, please stay healthy. How you can do, how you can stay healthy? Basically, this is the prevention. This is not what you must do while you were having COVID-19. If you're having COVID-19, means it's no more prevention, it's already a treatment. Okay, prevention is what we need to do before we get the infection. All right. The first and foremost thing is actually stay healthy. How you want to stay healthy? First, you have to maintain a good body weight. A normal BMI is less than 25. Okay. It has been shown in a study in UK that those who are overweight do severe, do bad, do worse compared to the patient who are with normal BMI. Yeah? So maintain a good body weight, BMI less than 25. Eat good food. What does it mean by good food? Not necessarily you like, if you think the good food is Kentucky or McDonald's, it's not necessarily good food. Good food means a balanced food. If you know, we have pinggan Malaysia, suku-suku separuh. I think a lot of you know about suku-suku separuh. Suku is quarter, half, quarter, half. In English, quarter, half, okay? So suku of carbohydrates, suku of protein, quarter of protein, quarter of carbohydrates, and half of vegetables or fibers, fruits, okay? So if you have one plate, you divide your plate into 4 areas. So one part, 1/4 of it, you put carbohydrate, can be nasi, can be potato, okay, can be bread, all right. And the other suku, you put protein, which can be chicken, can be fish, can be meat, and the half you put a lot of fibers such as green veggie, yeah, like you can put salad, you can put bayam, kangkung, whatever. What is a green leaf, green veggie. Okay, if you eat a good food, you're gonna have a good immune system that can fight over the virus. Okay, the third thing is don't smoke or drink alcohol. What happens if you smoke? Okay, when you smoke, basically your lungs has already damaged. All the brushing system, all the penyapu inside your lung to brush off the virus, to brush off the dust is damaged by smoking. So if you smoke, the virus can just goes easily into the bloodstream. Okay, it does not go to the lung, it goes directly to the bloodstream and make things worse. And why you cannot drink alcohol? Alcohol can reduce your immune system. Okay, so your immune system, your liver get damaged, your immune system will become lowered, and this will lead you to easily get contracted this COVID-19. Last but not least is regular exercise. If you do regular exercise, you have a good hormones in your body, the endorphin, the serotonin, all the hormones will go up, and these hormones are very good to maintain a healthy body. Okay, so these are the individual practice that you can do to prevent from getting coronavirus. Okay, next. Okay, prevention is better than cure, definitely. This is what our government asks us to do, putuskan rantaian COVID-19. This should be done at community level. Remember the viral makcik who was supposed to quarantine and didn't go for quarantine and go to the kopitiam and drink. Okay, so individually she has caused or affect the community. Okay, she might already spread the virus to all the customers who go to the cafe. Okay, so it's very simple steps. 3C or 3S we should avoid. 3C, crowded places, you avoid crowded places. Okay, if you see the places too many people, please don't go. Okay, because we never know who had the virus. And then, of course, avoid confined spaces, closed spaces like movie theater, okay, karaoke hub, okay, club. I think it's not open yet now. Okay, and if you want to bersembang or you want to talk to your friends, you want to ventilate your problems, you don't go nearby. Please maintain the 6 feet distance among your friends. All right. And of course, you have to practice 3W, which is wash your hand, wear a mask. Okay. Wash your hand. You can use soap, which is better. Water and soap compared to hand sanitizer, and wear a mask. All right. And if you meet someone you know, don't shake hand. Okay. And warning means you have to remember to yourself, don't shake hand. Maintain a good cough or sneeze ethic. When you cough, you just cover your mouth, right? Or use handkerchief or tissue. But now I think you already wear the mask, so it won't go to any person nearby you. Okay. And disinfection is also important. Okay, to remove all the infective organism, the virus, and to make sure the place are clean. And stay at home. Right now, if you don't have any important things to do outside, just stay at home. Okay. And also, if you have symptoms, don't go to the crowded places. If you're being quarantined, don't go outside. Don't go out the house. Just stay at home. Okay. You have cough, you just come back from overseas, just be truthful to the doctors or the healthcare providers that you are just coming back from overseas. Don't lie. Okay. Because it will help on our management to those who has potential to develop COVID-19. Okay. So this is prevention at community level. This is what we can do. Okay, but I think lately because of the PKPP, the pasar pemulihan, it should be pemulihan, but since now the trend has increased, maybe there's lacking of the practice of 3C, okay, and also 3W. That's why we can see the trend of COVID-19 is increased. I hope there will be no second wave or maybe third wave. I hope there's no, and we pray for a better condition in Malaysia. Okay. All right. I think last thing, I think because of the increment of the case in Malaysia, our government has make it compulsory for us, all of us, to wear masks in crowded public spaces from 1st August. So whoever who don't wear mask, you might be fined 1,000, if I'm not mistaken, 1,000 ringgit. Right? So you just wear your mask, whatever color, whatever design, whatever material it made of, as long as you wear mask. to prevent you also from being fined by the authorities. All right. I guess that's all, Chris. Any question from the audience?
Right. Right. Thank you, Dr. Noor Ashikin. Okay, I have some questions here. Some are actually in the chat. So one person is asking what type of vaccine is being used currently. That I think you shared earlier in your slides that actually one of the methods that the healthcare industry is looking at is actually to develop a vaccine, right? So I think the question is what type of vaccine. I know there's no vaccine yet, right? So that means I guess the question means what kinds of vaccines are they looking at? I don't know if that makes sense. Yeah.
If it's a medical term, it will be inactivated virus that we call is active immunization. Active immunization means you give the inactivated virus, meaning the virus has already become weakened and goes into your body, injected into your body, and active immune response will occur inside the patient's body, and the antibody will produce. That is the kind of vaccine that being produced now. If I may answer the question, that is if there actually vaccine, there's different types. So this is active immunization vaccine.
Okay, I hope that answers the person's question because it's a bit vague here. Okay, there's another question related to vaccines as well. So Miss Michelle is asking that she read today that Sinopharm has run trials and are developing a new vaccine which is expected to roll out by next year. So the question here is, will Malaysians be expected to have the vaccine yet? Should any development of an approved vaccine happen? Yeah.
Okay, Sinopharm is a China company actually. So the trial involved, I think, some in China, some in Middle East country. Because in China, there's not so many patients having infected with COVID-19, so it's a bit difficult to do the trial there. So they do in the Middle East country, and there's also one other vaccine company do a trial in Brazil, but there's no company as yet do a trial in Malaysia. So, but anyhow, I think the vaccine, because it's just go into the phase 2 trial, so it will take time before it comes to Malaysia, unless the authorities or maybe the government side do some collaboration with the China or the other country that produce the vaccine, and we might get the vaccine soon. But it's just a trial, it's not that everyone should take the vaccine. This trial means you give to a person and you see the response, whether it protect you from getting the COVID-19. It protect you from getting the virus. This data you need to study for few months to years, So I think maybe hopefully by end of next year or maybe middle of next year, we'll get the vaccine lah.
Yeah? Okay. So I think the next part of the question is that once everything is once we have enough data, then I guess then the government will make it compulsory for people to get the jab, correct?
Yes, definitely.
Okay.
And I think it's gonna be very expensive.
Oh, okay.
Yeah, like influenza vaccine that we have now. Last time it cost about 100 plus, 100 to 200 lah. Right. That is seasonal influenza, So it's a mild kind of virus. So I don't know about COVID-19. I think it's going to be very expensive. Maybe 500 or more. Maybe.
Right. Okay. Right. Okay, I have a question.
An expensive disease, Chris?
Yeah.
So prevent you from getting this expensive disease.
Sure. Okay, I have a question here from Mr. Kaniswaran. He's asking here, sanitizers are recommended to use to clean our hands. So is it advisable to spray disinfectant on human bodies before entering the workplace? So yeah, okay. I mean, I think, is it advisable to spray disinfectant on people before
Oh,
they enter?
you mean disinfect people?
Yeah,
Disinfect people?
yeah,
No, it's
yeah.
not
Disinfect.
advisable. It's not recommended.
Okay.
As we can see, a few places they put this some sort of tunnel with spray disinfectant, but it's not helping.
It's not helping, huh? Okay.
It's not
But is,
helping.
but
Yeah.
is it harmful to people when you have this?
Depend on what they spray. If they spray
What
Clorox,
they say?
it's very harmful.
Okay. All right.
Has to
Uh,
depend what they spray lah.
okay. Okay. So I have a question here from Wilson again. So he's asking if patients just wear more cloth and then to feel hot and they sweat a lot, is this a way to recover, or they stay under sunlight to get sweat? Because I think the question here is in relation to how sometimes when you have fever or flu, when you you just wear heavy clothing to sweat out the disease, right? Will you feel better, or is this a way to recover, especially in relation to someone who has COVID-19? Yeah. Can this
If you have
can you
if
sweat
you
out?
have infection,
Yeah.
sorry, what is that?
Can you sweat out the disease? You know, like how sometimes you have flu or you have fever, right? Then sometimes people will just bundle up and then they will and they'll sweat it out. You know what I mean? So they feel better after that.
Yeah.
Is this something that applies to COVID-19 as well?
Oh, actually, the sweating is our what we call a defense mechanism. It's not that we sweat out the virus. Sweating, once you have fever, your body will sweat. Why? Because it wants to cool down the body to its original temperature, which is 37. So if you sweat, your body will be a bit cooler than before. So it's actually the defense mechanism.
Okay.
It's not the way the body try to throw away or get rid of the virus. It's not the way.
Right.
Okay.
Okay, thank you. I think one last question. I think I don't see any more coming in. So someone's asking about the vaccine again. So someone's saying that they heard 2 days ago that there's been some development in Russia for the vaccine, and that there'll be mass production starting in August. Is this true?
Yeah, it's true. The Russia and the Europe's always fighting each other to produce the vaccine.
So Russia has a vaccine already.
I think it's true. They claim that, but I think it's true. But the mass production, I'm not sure whether it will be benefit to us or not.
Okay.
Why I say so? Because when the COVID virus goes from one country to another country, it has mutated again. So the virus in Russia might not be the same as virus in Malaysia, but the core virus is still coronavirus. So the testing, if Russia developed the vaccine, the testing has to be done in Russia.
Right.
If you want to use it in Malaysia, the testing should be done in Malaysia as well.
Right. So that means even though the vaccine is developed elsewhere and they've been successful trials, even if they bring it over here, we also have to conduct our own trials in Malaysia as well.
Yes. Okay, because this is not a biasa-biasa punya virus. No, this is like a very nasty, a very new nasty virus. So the trial might take months, but but I don't know. The biotechnologies, the AI is involved, the computering, the bioengineering all involved. Maybe can be faster lah, hopefully lah.
Right. Okay, thank you, Dr. Ashikin.
All right.
Everyone else, if there are no further questions, we'd just like to before we close, just like to share with everyone about upcoming training over the next few weeks. So I'm just going to share the screen for a little bit. Okay, so you can see the screen right now. So there'll be upcoming trainings. So on the 6th, because next week I think it will be Hari Raya Haji. So on the 6th of August will be our next training session titled Disinfectant Classes and Decontamination Methods, a Practical Approach. So this class is basically going to be a paid class for non-MPMA members. So fees are at 50 ringgit for Malaysians, and if you're from overseas, that's USD 20. And for the next topic, which is on 7 August, which is in the day after the next session, the topic will be on controlling microbial growth by disinfestation and sanitization. That again is a paid service. And as some of you have seen during the break, there will be a session organized by Sequest on Thursday, August 13th, to introduce this product called Process NPD, which is a disinfectant that you can use in replacement of other solutions that you have in place right now. So, okay, so thank you everyone. So we'll close today's session. Thank you for making time to come to make the time today to listen and to sacrifice your time to share, to learn from Dr. Noor Ashikin. And also, I think just to clarify, some of you are asking about the fees. So that's correct. It's going to be RM50 per topic for non-MPMA members. If you are an MPMA member, when you register, once the MPMA has vetted through your request and to verify you're an MPMA member, you will get the session for free. So those only who are not MPMA members have to pay for the session. Yeah. Okay. So thank you, everyone. Thank you, Dr. Noor Ashikin.
Okay, thank you.
All right.
Have a blessed Friday.
Yeah. So I will see you guys again in the next coming training. Stay tuned. There will be emails that will be going out soon. We will also be posting reminders through the MPMA on their Facebook page. So look out for links and emails as well on the upcoming topics. And we hope to see you again the next time. All right. Thank you.